Chemotherapy generally affects the cancer cells, but it also affects your normal healthy cells, which means your white blood cell, which is actually in charge of your immune system in your body. Not all chemotherapy drugs will affect the white blood cells, okay? But some chemotherapy drugs, when it reduces your white blood cells, the chance of you having infection is higher. So when people go for this kind of chemotherapy drugs, we normally tell them, try not to go out frequently, try not to have a lot of people around you, try to avoid crowded places, always wear a mask when you go out, and don't go to anyone who's actually having any infection like a fever, flu or cough, to reduce the chances of you having an infection. Generally nowadays, chemotherapy is an outpatient procedure. There's a lot of newer drugs where the chemotherapy treatment has been shortened. So you just come in the morning, do your chemotherapy, and you can go back in the afternoon. However, there are certain kind of cancers where you need an intensive kind of chemotherapy where the drugs can carry on for 48 hours up to 5 days. So those patients need to be admitted for chemotherapy. Even after you finish your chemotherapy, it is very safe to go back home. You don't need to stay in the hospital after your chemotherapy. After a chemotherapy, there is no contraindication for anyone to have a separate bed or a separate utensils for eatings and all. Everyone can mix around together. You can share the same room, you can share the same toilet. There's no issues at all. Regarding visitors, we need to be a little bit cautious because some visitors might be carrying some infection. If they're having like fever, flu and cough, try to avoid them and try to avoid going to a crowded places. But otherwise, having regular visitors, just wear a face mask, that should be okay. After chemotherapy, it depends on individual. Some patients tolerate chemotherapy very well, so they can actually just go back to work. But some patients, they develop a little bit of toxicity, so they may need some extended rest before they can go back to work. After a chemotherapy, if a patient has some side effects, but they are still able to do their activities of daily living, for example, able to take care of themselves, able to eat, able to go to the toilet and all, and they have some side effects, that is still okay. Carry on with the medication which the doctor has discharged you with. But some patients, the moment they can't do their activities of daily living, they are vomiting around, they are just lying on the bed, they don't have energy to get up, they can't eat, then they need to go to the hospital. Okay? The most important thing after chemotherapy, if you have fever, you need to go to the hospital because the chance of you having an infection is very high. Our Asian population tends to use a lot of complementary medicine together with our modern science. Okay. There is no issues using complementary medicine. However, you need to get it from a proper traditional and complementary medicine physician. Okay. An important thing for us to understand is traditional and complementary medicine is always used as a supplement to modern medicine. It is never used as a substitute to normal medicine. So even a cancer patient who are undergoing treatment, you can use some supplementary medicine to reduce some side effects of chemo. But you can't use it as a sole treatment for your cancer because there's no scientific evidence which shows that traditional and complementary medicine can kill your cancer cells. My advice for a patient who's going to start chemotherapy is always have an open mind. Never compare yourself with someone else because everybody is built differently. Everybody is getting a different chemotherapy dose, a different chemotherapy regime. So everyone will have a different side effects. Important thing is always talk to your doctors. Okay? There's a lot of newer chemotherapy drugs, a lot of new anti-nausea, anti-vomiting medicine, all which we can use to reduce the side effects of chemotherapy. And importantly, keep yourself fit. You need to be able to exercise a lot, you need to be able to eat as much as you can, and if you really can't eat, take some supplemental formula. It helps to boost your immune cells also. Keep yourself active and healthy. And lastly, my final advice to my patients, I would like you guys to actually live a normal lifestyle during your chemotherapy because there is no reason for you to isolate yourselves, to stay at home. You can actually go to work, you can carry on with your daily activities. Just enjoy life during your chemotherapy.